Abdul Sattar Edhi, revered as one of Pakistan's greatest humanitarians, dedicated his life to serving the marginalized and underserved populations of his country. His legacy, embodied in the Edhi Foundation, spans a wide array of humanitarian services and initiatives that have profoundly impacted countless lives. Here's an in-depth exploration of Abdul Sattar Edhi's services and humanitarian works. Chapter 1: Early Life and Inspirations. Abdul Sattar Edhi's upbringing in British India and later Pakistan profoundly influenced his humanitarian mission. Born in 1928 in Bantva, Gujarat, he witnessed firsthand the struggles of people during the partition of India in 1947. These experiences planted the seeds of empathy and compassion that would define his life's work. Chapter 2: The Birth of the Edhi Foundation. In 1951, Edhi established the Edhi Foundation in Karachi with a modest amount of Rs. 5,000. Initially focusing on providing medical aid and emergency assistance to the impoverished, the foundation gradually expanded its scope to include a wide range of social services. Chapter 3: Emergency Medical Services Ambulance Network. One of Edhi's most recognized achievements is the establishment of Pakistan's largest ambulance network. The Edhi ambulance service operates round the clock, responding to medical emergencies across the country. Edhi himself often drove ambulances, underscoring his hands-on approach to humanitarianism. Chapter 4: Orphanages and Child Welfare. Recognizing the plight of orphaned and abandoned children, Edhi opened numerous orphanages under the Edhi Foundation's umbrella. These facilities provide shelter, education, healthcare, and emotional support to children who would otherwise be destitute. Chapter 5: Homes for the Elderly and Disabled. Edhi extended his compassion to Pakistan's elderly and disabled populations by establishing homes and rehabilitation centers. These facilities offer long-term care, medical treatment, and vocational training, empowering residents to live with dignity and independence. Chapter 6: Healthcare Services. The Edhi Foundation operates several healthcare facilities, including clinics and hospitals, which provide free or subsidized medical care to the underprivileged. These facilities play a crucial role in addressing the healthcare needs of marginalized communities, particularly in remote and underserved areas. Chapter 7: Rehabilitation and Social Welfare Programs. In addition to medical services, the Edhi Foundation runs rehabilitation programs for drug addicts and individuals with disabilities. These initiatives aim to reintegrate marginalized individuals into society, offering them a chance to rebuild their lives with dignity and support. Chapter 8: Disaster Relief Efforts. During times of natural disasters, such as earthquakes and floods, the Edhi Foundation mobilizes its resources to provide emergency relief. This includes distributing food, water, shelter materials, and medical aid to affected communities, often working in collaboration with local and international relief agencies. Chapter 9: Education and Literacy Initiatives. Edhi recognized the transformative power of education and invested in initiatives to promote literacy and skill development among disadvantaged youth. The foundation supports schools and vocational training centers, enabling children and young adults to break the cycle of poverty through education. Chapter 10: Women's Shelters and Support Services. The Edhi Foundation operates shelters and support services for women facing domestic abuse, violence, and homelessness. These facilities offer a safe haven and comprehensive support, including legal aid and counseling, to empower women to rebuild their lives independently. Chapter 11: Special Initiatives and Outreach. Throughout his life, Edhi launched several special initiatives to address emerging social issues and community needs. These include programs for street children, environmental conservation efforts, and campaigns to raise awareness about public health and hygiene. Chapter 12: Funding and Sustainability. Despite relying primarily on private donations and contributions from individuals, the Edhi Foundation has maintained financial sustainability through prudent management and transparency. Edhi's refusal to accept government funding preserved the foundation's independence and integrity. Chapter 13: Challenges and Controversies. Over the years, the Edhi Foundation has faced challenges, including political pressures, financial constraints, and logistical hurdles. Despite these obstacles, Edhi's unwavering commitment to humanitarianism ensured the foundation's resilience and continued growth. Chapter 14: Global Recognition and Awards. Abdul Sattar Edhi's selfless dedication earned him international acclaim and numerous awards, including the Rahman Magsaysay Award for Public Service. Nominated multiple times for the Nobel Peace Prize, Edhi's global recognition underscores his profound impact on humanitarian efforts worldwide. Chapter 15: Legacy and Impact. Abdul Sattar Edhi passed away on July 8, 2016, leaving behind a legacy of compassion, integrity, and service. His life's work continues through the Edhi Foundation, which remains committed to upholding his vision of a compassionate society where no one is left behind. Chapter 16: Conclusion. Abdul Sattar Edhi's services and humanitarian works exemplify the transformative power of empathy and action. His story serves as an inspiration to individuals and organizations worldwide, reminding us of the profound impact that one person's dedication can have on the lives of millions. This comprehensive overview aims to capture the breadth and depth of Abdul Sattar Edhi's humanitarian services and initiatives, highlighting his enduring legacy as Pakistan's most beloved humanitarian icon.